Welcome to the Protecting Your Nest podcast. Today, I wanted to focus on the men, but it's a conversation that the ladies may find interesting as well because most have men in their lives. This may not surprise you, but did you know that men are more likely to die from 8 of the top leading causes of death in the US than women? And are more likely to smoke and, of course, drink excessively. So the question is, why are men at such high risk? Well, one reason is that they don't go see the doctor. And the question is, why don't they go see the doctor? And sometimes it's because they feel that they're too busy. Sometimes they're afraid of finding out what may be wrong. They don't, they're not comfortable with somebody, touching their bodies at times. And even just asking personal questions, sometimes men are not excited about that. So these are some of the reasons. But I think it's so important that we give the men in our lives the attention they need. We need an episode of the podcast to meet men where they are and give them some interesting ways of healing and being healthy. And that's why I'm so happy to have my guest today, Dr. Judson Brandeis. And Dr. Brandeis is an award-winning urologist and sexual medicine expert. And a lot of the guys are interested in their sexual health. He's a clinical researcher, physician educator, and author of his new book, The 21st Century Man, Advice from the Top 500 Docs and Men Health Experts to help us feel great, look great, and of course have better sex. And it's really amazing because they've already labeled his book as the Dude Bible and the magnum opus of men's health, which is really kind of cool. So it's nice that he took the time to dedicate some attention to men's health because we really need it. His research is really important and it's helping to define how we should live if we want to be healthy as men over 35. And it helps us to maximize our health so we can live our best life. And I really appreciate the work he's doing. So I'm totally excited since I just happen to be a man over 35 to welcome.
It happens to the best of us.
Just happens to the best of us. Welcome to the podcast.
You stick around long enough, it happens to the best of us.
That's right. So thank you for being here.
Appreciate man, this. Tony, thank you for having me. And I appreciate the work that you do. It's really fantastic.
This is it, man. We're busy. I was like in between patients trying to get to our interview, and I'm excited about it and decided to do this one at work. But I'm a family doctor. You're a urologist. So I guess the first question is, why urology? What made you choose that as your specialty?
Yeah, well, I started out really interested in kidney transplants. So after I went to Brown University for undergraduate, I worked at American Red Cross in Rockville, Maryland, and I worked for Harold T. Merriman, who figured out how to freeze blood. And so what we were actually trying to do is freeze kidneys for transplantation. And so we could actually freeze a rabbit's kidney and then defrost it and put it in another rabbit, and the kidney would work. And so I became really interested in kidney transplantation. I did a year of research at Harvard Medical School in the lab where they did the first living-related kidney transplant. And then I trained in surgery and urology at UCLA, which has a very, very busy kidney transplant practice. Although I decided ultimately that I was more interested in general urology and prostate cancer and kidney stones. And now I'm really fascinated with advancement in the treatment of erectile dysfunction and regenerative urology.
Nice. And that's, again, a very important topic for men. And we need to be innovative. Sometimes we'll, just like pain medicines, you'll come up with a group of medicines to treat pain, and then nothing ever happens after that. So I think we need to keep the innovation going so that men will have other options. And the more we talk about it, the more they'll be comfortable talking about it as well. So I think that's awesome. I wonder if you could talk a little bit about, men and health and the challenges that they face. Because, I sit here in this clinic and sometimes I'm looking for the male patients. Now, I'll be honest, because I have some more senior men, they may show up. But when you get into that 35, and 40 and 45, sometimes they don't show up. But what challenges do they face?
Well, I mean, men's health in this country is a catastrophe. 100 years ago, women lived 1 year longer than men.
Mm,
Now women live 5 years longer than men.
mm,
So what happened over 100 years that men lost 4 years of their life expectancy? And if you look at it, even before COVID, the lifespan of men in this country was actually dropping.
mm.
And it was dropping because of alcohol, opioids, and suicide, diseases of despair. And if you look statistically, 50% of men have high blood pressure, 40% of men are fat or obese,
Hmm.
15% of men still smoke, 12% of men don't have health insurance. And men are 50% less likely to go to the doctor than women are. Right? I mean,
Wow,
that's a
that's pretty
disaster.
big. Hmm.
And I agree with you, all the things that you said about why men don't go to the doctor. The thing is, it's like you don't take your car to the service department when it breaks. You take it beforehand so it doesn't break. The thing is, in your 20s and 30s, it's important to understand you can get away with a lot of stuff, right? I would go out all night partying with my buddies, show up to work, the next day, do rounds at 5 o'clock, get through the day, no problem. But, I'm 55 now. I can't do that kind of stuff anymore. But the thing is, if you don't change your lifestyle, you pay the price for the way that you were living in your 20s and 30s and 40s. So, the 55-year-old Tony could either say, "Man, the 30-year-old Tony really messed me up.
Hmm.
I'm fat, I'm out of shape, my testosterone's bad, I can't get an erection." Or the 55-year-old Tony could say, "Man, that 33-year-old Tony, he really hooked me up, man. I feel great. I'm trim,
Right.
I'm muscular, I got my wife's happy." So it's the decisions, the health decisions that you make when you're younger, and the habits that really sustain you in your older life.
Yeah, I agree. I literally just released a video talking about, I compared my old Jaguar, which is the, British way of saying it, to a human body, right? And I talked about how, well, if you leave it in the garage, and I did this experiment, it's not gonna it's not gonna run like it should. And if you put that cheap gas, and God knows the prices are high right now, if you put the cheap gas in that, it's not gonna run as well. And the human body is the same way. And of course, you need your maintenance checks and things like that. But we're no different. But sometimes we treat that luxury car better than we treat our body. And that's, and again, I want to be able to look down the road. I kept that car for 20 years. I want to be able to look down the road and say, man, I am doing okay today because I did the right things. And I think what's cool about your book is people need a kind of a guide, things to think about. We're living in the healthcare world, so we think about these things. But the average guy, I saw a plumber today, and he's focused on plumbing related issues. He's not thinking about these things. So our job is to give them some guideposts and an idea of what to do. So when you think about, what harms people the most, right? What leads to premature death? And I think about things like heart attack, stroke, cancer, dementia. So my question to you is, what can we do as men to reduce our risk of, dying from the things that tend to take us away from this place?
Yeah, I mean that's the critical question, and the answer is really simple. But in some respects, it's not that simple. So, I mean, if you ask men, what can you do to improve your health? Don't drink alcohol. Don't smoke. Don't
Mm-hmm.
do drugs. Don't eat too much. Exercise every day. Stretch. Meditate. Be nice to people. Right? Simple and pretty much free. But the thing is, life intervenes and the pressures of life intervene. And we have coping mechanisms and bad habits that sort of quote, get us through those tough times. Oh, I had a really stressful day at work. Let me get a bottle of wine or a glass of bourbon or something like that. And or sometimes I'll have a really bad day at work, or something's stressing me out, and 10 o'clock I take out a thing of Ben and Jerry's and put down the whole pint. Uh, and and that's where things start to go off the rail for us. We all know what to do. I tell people I take care of the 99% of problems, and I take care of the 1%. Right. So the 99% of problems you could probably avoid by eating better, don't drink, don't smoke, don't do drugs, exercise, be nice to people, stretch, and do some meditation. Right. And then there's the folks that are at the 1 or 2% level that are looking to get to the next level. So, I do peptides, and I do hormone optimization, and I have these incredible advanced, muscle building technologies and so on and so forth. And I'm doing all sorts of really cool clinical research projects. So, I work with the regular folks, and I work with the high achievers. But in terms of what we all can do, it's all pretty basic. It's kind of the motivation. And the first chapter of the book is called The Hero's Journey.
Mm-hmm.
And it's a concept by a guy named Joseph Campbell. He looked at world mythology and tried to figure out, what is the hero's journey that cuts across all societies. And I think it's really important for men to see themselves as the hero of their own journey.
Mm-hmm.
In our society, so many times we sort of romanticize, like, oh, I'd love to be Tiger Woods, or oh, I'd love to be Johnny Depp. But you know what? Look at Johnny Depp, man. I don't know if I want to be Johnny Depp, right? Just be yourself and
Yeah.
assume that everyone else in the world has problems, and just make decisions for yourself that solve your own problem, and let Tiger Woods and Johnny Depp solve their own problems.
Wow. Yeah, I hear you. And it just kind of speaks to, like, what are the secrets that help you reach your potential? I think about, you know, where I'm at in life, and it's no accident that I just happened to find my way to a field of medicine, or just medicine in general. But I had a mom who, even though she was a single mom, she worked really hard to kind of make sure I had stability and structure with my older brother. And later, I ended up with a stepdad when I was a teenager who was another source of stability. Had an uncle before my stepdad showed up who was kind of like my father figure, since my biological father wasn't really involved. And I know that they helped me reach my potential. So I just think that there are things that happen in our lives that help us to see the world through the right lens. And from your perspective, you know, a lot of men never reach their potential. So it sounds like what you're saying, it has something to do with what's going on in their brain. But what's your thoughts about how do we reach our potential? Because I think we all want to do that.
Yeah, so everyone's a little bit different. I think what really helped me reach my potential was just a work ethic and a determination, and never allowing myself from being knocked off the rails of achieving the vision that I had for myself and my family and my professional career. I mean, I went through uh, it's in chapter 101 of the book. So the very last chapter. So the whole book, I really don't talk about myself at all. It's all very much oriented towards the men that are reading the book. The very last chapter, I sort of bring myself into it. Okay, nobody in this world is perfect. Everyone's got problems. Okay,
Mm-hmm.
here's my sort of confession. This is what happened to me. So about 3 years ago, even though I was voted the top urologist in the San Francisco Bay Area for the past 9 years, I built the robotics program. I built the MRI guided prostate biopsy program. I built the kidney stone program. I was running my group for a long time. My partners wanted to sell themselves to the hospital. I didn't want to sell myself to the hospital, so they fired me.
Mm,
And I
mm.
had to basically pick myself up off the ground and restart, at
Did that
50,
come
51
from,
years old.
was that was that inside of you, or did you have things outside of you that helped you in that moment? That
Um,
confidence.
yeah, I grew up, I ran track and cross country in college. I was a triathlete. My father owned a small business in New York. I saw him work really, really hard, every day getting on the Long Island Railroad. And it was just inside of me that, like, the idea of giving up and not fighting to the finish line just didn't even exist in me. And it was just a question of, okay, what do I do next? Set my sights on a goal and then just break it up into little pieces and just go after it.
And it just seems like, from an emotional perspective, that would be a very challenging time in that moment. And when I think about the acronym, my NEST, right? The T is for how we think. And I know how important, and then the rope in the acronym, the E is for making sure our emotions are okay. So I think those are very healthy in order for us to be healthy. And it seems like when you are in that moment of struggle, when things weren't as planned and they're saying we don't need you here anymore, especially, just dealing with mental health and things like that. How, so it just sounds like that's important for men to address that. But we're living in a society where we're not always, taught how to do that. I think about how Will Smith responded when he felt his wife was being, talked to in a way that wasn't appropriate. And I just think that, so how important is that? It's almost like that, I did a video, how, emotional intelligence, right? But where do you get that emotional intelligence from? And,
Let me know what store that's at all. If it ever comes on Amazon, I'll buy it up.
exactly. So it just sounds like our emotions are important. So
Yeah,
as you've done your
so
research,
I really honor what you're saying, and most men's health books are about exercise, food, and sex, right? Like we're cavemen, right?
that's right.
But there's actually a section in the 21st Century Man on mental health, written by, not by me, but by really good psychologists and psychiatrists. So on
Mhm.
depression and anxiety, on vitality, on work-life balance. And there's a whole section in the 21st Century Man on relationships, right? On relationships with your spouse, on fatherhood, on really a number of topics. So and if you look at the Harvard longevity study, looking at men for 75 years and following them and their children and their children's children, the single most important factor in men's health is the quality of their relationships. It's more important than getting a colonoscopy or a PSA or taking an aspirin or going to get a checkup, is the quality of your relationship. So uh, I have this concept. I haven't really written it up yet, but of that Maslow's pyramid,
Mhm.
right? But it's a Maslow's pyramid for men's health for men over the age of 40. And at the very
Mm.
bottom is physical health, right? If you don't have physical health, everything's going to crumble. Um, Above physical health is mental health. Above that is emotional health. Above that is relationship health. And above that is sexual health, right? And you
Mm.
can't get to the top of that pyramid if you don't have physical health, mental health, emotional health, relationship health. And then when you have all that, then you can really focus on sexual health and that physical connection and intimacy between you and your partner.
Nice. The relationship piece resonates with me. Um, and again, the R in the rope is for relationships. Now, why would we bother talking about relationships? Well, because when people struggle, whether it's a man or a woman, I see that a lot of times I have to look at who they partner with, right? And if you've partnered with somebody who is gonna, kind of be, kind of an accountability partner while also being a supportive kind of person who can also periodically play the role of a coach. Sometimes we have to model what we think is good. So I think the people we hang with, I tell my kids are now, basically 20, they'll be 23 and 25 this year. And what happens is, I always talk about who you hang with, right? And who you hang with matters. Even in my obesity training, when I was getting my obesity boards, the relationship between the person who may suffer from obesity was the greatest with their friends than it was with their family, which was ironic. So if they had friends who suffered, was even crazier. The friends of their friends impacted them as well. So relationships really matter. And I think it's important as clinicians, we are aware of that so that when people struggle, we'll know where to look for where the source of the problem could be. And again, we're trying to keep relationships together, but we also have to know how to manage those relationships so they don't cause harm. So that's really important. Um, I
Yeah.
look at you. Yeah, you got some thoughts on
No, I
that?
mean, I totally agree with you. It's the quality of relationships, but we're kind of getting like really deep into a patient encounter.
Mm-hmm.
And uh, you and I both know that there's a huge pressure on physicians in terms
Mm-hmm.
of throughput. You have to see 4 patients an hour, or the HMO or the PPO or the your organization is going to ding you. And
Mm-hmm.
so, I don't suffer from that anymore because I'm private pay. And
Mm-hmm.
the stuff that I do is never going to be, well, I don't know, never, but probably won't be ever insurance based. Um,
Mm-hmm.
but there's a part of the book and also a video I put on the 21stcenturyman.com website that helps people um, get the most out of their physician visit. Because
Mm-hmm.
Cerner did a study on 100 million charts and found that the average physician visit is 16 minutes and 14 seconds.
Mm-hmm.
And so, and you probably agree with me that when your patients come in, it's not a good use of time to talk about the weather or their sick cat or the car that they just bought. First of
Mm-hmm.
all, get down to business. Second of
That's
all,
right.
and I have the video, I tell all my patients, all my friends, write down your medical history, right? What medical problems you have, what surgeries have you had? Do you drink? Do you smoke? Get a list of your medications, not just the current ones that you have, but the ones that you've tried in the past and didn't work. Get a list of all your imaging studies you've ever had, chest x-rays, back MRIs, brain scans, whatever you've ever had, make a list. Um, then write down a history of present illness, right? Why are you actually at the doctor's office?
Mm-hmm.
I hurt my back 3 weeks ago falling off a ladder. I would started 10 out of 10 pain. Now it's 5 out of 10 pain. I couldn't walk for 3 days. I was bedbound. I had a similar episode 5 years ago. I got an MRI at that time. I got an epidural at that. Just write down everything you can possibly think of and then write down a list of questions. These are
Mm-hmm.
the questions that I want the doctor to answer for me. Take that stack of papers. As soon as you get in, you hand it to the doctor. You'll get a big smile from the doctor. The doctor will I have a dictation system. I dictate the whole thing. It takes me about 4 minutes. I pull out what the
Yep.
pertinent positives are for me, and boom, I got 12 minutes now to talk with
Right.
you about why you're here. And then you can
Mm-hmm.
actually get into that situation, like who you hanging out with, who you eating with, what are you eating, what kind of foods are
Right.
you eating? Are you eating processed foods, regular foods? Are you Mediterranean, keto, all that kind of stuff? But if your doctor has to tell it I mean, it's such a waste of time when I have to tell my staff, go get these labs, go get these imaging studies. You
That's
know,
right. That's right.
when did the problem start? All these questions that are obviously part of your history of present illness. The doctor is going to answer these questions. Just write it down. The being with a doctor these days, it's a partnership, or it should be a partnership. Back in the day, doctors lived on the top of a great mountain. and
Right.
they had access to information. So when I was at Harvard Medical School doing research, we would go to the Harvard Medical School library. It had 1 million volumes. It was the biggest medical library in the world, and people would fly from all around the world to get esoteric articles and esoteric journals. Right now, I got a cell phone that has the same information that I could get from the Harvard Medical School library. Right. And so your
Yeah.
patients have this access to information just like you do. Patients will come in, oh, I read this study, I read that study. And for me, that's totally cool. But in order to get to that level, you have to provide your doctor with information. You have to be a partner in that relationship. Otherwise, at the end of the day, you can't look at your doctor and say, well, listen, you didn't answer my questions. You didn't come to a correct diagnosis.
Everything about that I love, because, and I can actually see how, because I think about the patients who come to the office who've done that. I have not coached them to do it the way you have. I have casually, but not as a routine. And then I think about the value added. And the value I have, I think, is really about wellness and lifestyle, but I need time to do that, right? So I have, sneaky ways to do it. I make videos, I have handouts, but man, I agree. I use a virtual note taker as well. So I can just walk in a room, literally just say all the things that they've shared, and then I can focus. Then I have all of this time to educate, coach, guide, problem solve, so we can get to the root cause. Because maybe again, it's the relationship. But if you don't have time to get to the relationship, you would have spent that time, those 16 minutes together, and you don't really get to the answer. And at the end of the day, we want to get to the answer. We want to get to the potential solution. So that definitely makes sense. So hopefully others will start to
Yeah.
integrate that
Well, I mean, the
approach.
thing is, the patients want to get the answer. They're coming in with a
Right.
pain point and they want to get that addressed. They want to get their questions addressed. At the end of the day, for a lot of doctors, it's about sort of, I mean, I hate to say this, but it's punching the clock. Okay, I saw this patient. Okay, I saw that
That's
patient. I
right.
got my paperwork done. I got the PQRS documentation done. I got the vital signs done. I got all the boxes checked so that I can bill at a level 3 or a level 4 or level 5. Right. It's really the patient's responsibility to get the information that they came for and to get the diagnosis and to get information about the side effects of the medications, et cetera, et cetera. Like I can send you a copy of that video that I made. I send that video out to my patients before they even walk into the door. And I love what you're doing about putting stuff on YouTube. I have a YouTube channel too. I and I make a bunch of ebooks and I have my book. I expect my patients to come into the office educated so
Right.
that I can have a second or third or fourth or fifth tier conversation with my patients. Don't you have a certain amount of time with me? I'm really
Hmm.
educated. I have all these fancy diplomas up on the wall. I do research, I do physician teaching. Make the most of your time with me and I'll provide you those resources so that I don't have to teach you the basic stuff. You can ask me really good questions. And I think that's to me being a good patient
Hmm.
and being a good partner in your own healthcare.
Yeah. It's all about partnership, collaborating together. And I think about, I think even if you think about this conversation, I think a lot of men who are listening, and maybe even some of the ladies would say, these guys are talking about men's health in a slightly different way, right? It's like, like you said earlier, it's like, okay, how do I, build muscle? How do I, stuff that men think about, but it's a little deeper than that. And a lot of it is in between your ears. I'm looking at you, and I think a lot of people were probably surprised when you told your age, right? So everybody wants to, be as healthy appearing as possible when it comes to our appearance, right? And yes, ladies, guys are shallow and we care about our looks. Yeah. We are. We care. So what's your thoughts on some tips on how to make sure we look our best? Like
Yeah.
what would you say?
So, that's a great question. And there's actually a whole section in the book I have plastic surgeons, dermatologists, cosmetic dermatologists, because that's really an important an aspect. But you know what? It's really simple. Women have already done it. All you have to do is look at what women do. The simple stuff that guys don't do that, like I still don't do, is put sunblock on. The
Hmm.
most damaging thing to skin is the sun,
That's
right?
right.
But there are simple things that women do, like Botox or Dysport, that men don't do. There's hair replacement, there's hair removal. So there's information, and there's a chapter in the book on hair removal. There's information in a great chapter written by Miguel Canales, who, let's see, went to Stanford, Harvard Medical School, Stanford for surgical residency, helped start Intuitive Surgical, which is the company that makes the Da Vinci robot. Then he left Da Vinci with Fred Moll and started Artaz. He's got his name on 11 patents on the Artaz hair replacement robot. So, I mean, if there's anyone in the world that's going to give you advice on hair replacement, it's Miguel. So, there's hair replacement. There's a chapter on fat removal technologies. So, liposuction versus cool sculpting versus sculpture. Uh, and women are already doing it.
You're blowing my mind right now because that's not the answer the audience probably expected to hear you talk about. Like literally, and it's so funny, even though this is not as cosmetic, I'll be doing LASIK in a few weeks. And I think you're right. Like my brain doesn't even think about these things, and you definitely think of it as things that the ladies would do. But then there's a reason why, they walk out the door and they look like beautiful creatures because they take the time to focus on those areas, and we already know that if what you eat, you become, and we need to do those things also. But there's some other technologies out there that may help you. So that's a very interesting, surprising response, and I think my audience will be impressed with that. So I definitely think they'll look forward to hearing your other tips in your book as well.
Yeah.
That's
I mean,
amazing.
the thing is, I only take care of men. Like I only see men, and then I'll help take care of their spouses or their partners. Um,
Hmm.
but as new patients, I only see men, right?
Yeah.
And it's because I understand how to work with men and how to work with men. You can't tell a man what to do,
Hmm.
right? You can't, like, for example, I can't tell a man stop drinking alcohol,
Hmm.
right? But the really fun thing I do is I love this. It's one of my favorite things to do, right? Because I get all these like high flying guys, CEOs and doctors and lawyers and people that think
That's
that
right.
they're really smart and they know what they're doing. And I put them on my body composition machine. So it tells them how much muscle they have, how much fat they have, so on and so forth. And so, like, I'll get a guy with 30 pounds of fat and he's like talking about, well, I can't lose weight, this, that, and the other thing. And I'll say, oh, and you drink 2.5 glasses of wine a day.
Hmm.
Oh yeah, I love my wine. I'm up in Napa Valley, and I'm friends with this guy and that guy in the valley, whatever. So okay, do me a favor, take out your iPhone. Okay, all right. Google how many calories are in a glass of red wine. 125 calories. Okay.
Hmm.
Now, if you're two and a half, say 300 calories a day you're getting from wine. Okay. Now multiply that times 365 days a year.
Hmm.
Okay, that's the number of calories that you're taking in through wine. Okay, divide that by 3,500, which is the number of calories per pound of human fat. Okay. All right. What number do you have? 28. What does that represent? I don't
Hmm.
know. That's 28 pounds of fat
Hmm.
that you're putting on your body every year based on drinking 2.5 glasses of wine. So if you want to lose 28 pounds next year, just stop drinking wine and you'll probably save yourself a couple $1,000.
Yeah, right.
Or you could just keep doing the same thing that you're doing and see if that works for you.
That's
But
right.
I didn't tell him to do anything.
That's right.
And I tell them, I
You,
said, click the little buttons on the side. So you take a picture of that number of, 28.4692 and leave that in your pictures just in case you forget how many pounds of fat you're putting on each year by drinking wine.
yeah,
Right?
I
I don't
love
have
that.
to tell I don't have to tell them anything. I just
Yeah,
give them information, and that's what's in the 21st century man. Is
yeah,
it's dense information. It's not one of those books I can't stand, Tony, when I read a book that's 300 pages and at the end of the book I'm like, that's 4 pages of information and 296
exactly.
pages of crap.
That's right.
Okay,
Me neither.
I guarantee you I either wrote or edited every single word in that book, and every word is there for a reason. It's a
Hmm.
900-page book, and the least number of pages it could have been written in is 900 pages.
Mm-hmm.
And it's funny. I got all sorts of patient anecdotes and stories and quotes. It's
Hmm.
written by and for guys like you and I,
Hmm.
right? There's no ghostwriters that don't
Yeah.
understand us. This is a book written by us for us.
Well, we need a
Isn't that a
book.
FUBU?
Uh, we
This
need
is a
that.
FUBU book for us by
Yeah.
us.
Right. Right. That's right. That's
Yeah,
right.
I
We
know.
need it. It helps us. I mean, we need that information, and I am always uh, happy when I hear a doctor or advanced practice clinician uh, put information in front of somebody in an easy to digest way. So I use my phone often when I'm talking to folks. And oh, by the way, that's my wife on there.
Oh, nice.
That's right. So um, and we talk about here's some simple information in front of you. And again, I like the approach, which is here's the information. Here are some things that you can do with that information. Then let them decide. I think that because I think you're right. Uh, Men definitely, and in some cases, human beings need to have some skin in the game. So if they're able to kind of chart their path a little bit, having gotten the new information, I think they do much better. And I just like that approach. And it's hard you can't unlearn what you just shared with him, right? They can't unlearn that alcohol is going to turn into that much fat. Now, and since I'm in the whole low carb space, I always think about, your body's very smart. So if you are consuming alcohol and you want to burn fat, you pretty much shut down the fat burning process once you consume alcohol, because your body's focused on, I need to detoxify you because you just put this toxin in my body. So, if anybody watching or listening, we're not saying don't drink alcohol ever. What we're saying is you need to know that information so you can make a decision about how much you consume or how much you minimize. I just think
Yeah.
that that's really
So this, Tony, this is what I say about alcohol. There's 4 things I tell my patients about alcohol. And I stopped drinking alcohol. My wife and I stopped drinking alcohol about 10 years ago. Um, just because my kids were becoming teenagers and we didn't want to have it in the house. Okay. But so alcohol is ingrained in society, right? So when you're young, you go to the ball game, you drink beer. When you're older and you think you're sophisticated, you drink wine. When you go out with your buddies, you go and drink bourbon or whiskey, whatever. Okay. So the advertising people in the United States have convinced us that this is an essential part of life. Okay. But the flip side of that is that alcohol, the class of drug that alcohol is a depressant. Right? So it makes us sad. Second of all, alcohol disinhibits us. So most of the stupid things that most of us do in our life are done under the influence of alcohol. Car accidents, domestic abuse, saying the wrong thing, unwanted pregnancies. I could go on and on and on and on, but we all know stupidity, alcohol breeds stupidity. And the third thing is it's empty calories, so it makes you fat. So this is something that the advertisers are telling us that we have to have, but it makes us sad, stupid, and fat. So you choose. Do you want to be sad, stupid, and fat and poor, right? Because it's not cheap, Or, you know, do you want to stop drinking alcohol? Hey, Tony, I lost your audio for some reason.
Oh yeah, that's right. I'm sorry.
There
It
you
was a
go.
little muted. So yeah, I think about my nutrition and functional medicine training. And we consider alcohol a toxin. So so we have a lot of toxin exposures in our lives. The air we breathe, sometimes what is put in food if we didn't prepare it ourselves. Uh, the noise, it's hard to sleep because we recorded this around the 4th of July holiday. It's hard to sleep when you hear a lot of noise. So there's a lot of forms of toxins. Our job is to remove things that harm us. Sometimes we have to repair what we were harmed by. And if we were talking about the gut, sometimes we have to, I'll have a guest talking about probiotics. So we have to re-inoculate sometimes and add the good stuff back. So there's approaches to being healthy. The goal is to minimize toxic exposures. Now, one exposure we can't change is our genetics, right? So somebody may look at you and say, he looks, decent. He's got good genes, right? And they'll say things like that. And there may be some truth to that. Their genes do matter. But talk a little bit about our genetics versus our lifestyle choices, and which one should be of more value.
Yeah, I mean that's really a critical question, and there's a great chapter in the book written by a geneticist. So there are cancer genes that severely predispose you to cancers, and if you have those genes, then you need to be hyper vigilant in terms of picking up cancers, early colonoscopy or early PSA or, prophylactic mastectomy, those kind of things. And it's a very complex and evolving field. And every year or two, there's going to leaps and bounds are occurring in that field. But at the end of the day, you really can't, at least at this point, change much what you have in terms of genetics. The only thing that you can really deal with is the epigenetics, how what you're doing is affecting the expression of those
There you go.
genes, right?
Yeah.
Like if you're 5'6", you're probably not going to play in the NBA. So you got gypped in the basketball genes, but that doesn't mean that you can't do something really meaningful, even athletically, with your life. You just have to adjust. And I go back to those 8 or 9 super easy things that everyone can do in terms of eating. Don't drink, don't smoke, don't do drugs, exercise every day, meditate, stretch, and be nice to people. I mean, those are all free. They're all within the capability of all of us. And if you do those things, you're going to reduce your risk of 90, 95% of diseases. I mean, the book really starts with the top 10 preventable causes of death, right? So heart disease, including strokes, including, pulmonary embolus and venous disease. So circulatory diseases, I mean, it's a question of diet and exercise and weight management and not smoking, not taking in toxins,
That's right.
and cancers. Exercise reduces your risk of cancer. Not smoking, not drinking heavily reduces your risk of cancer. The foods you eat have a tremendous effect on cancer. So, there you pretty much knocked out 40 or 50% of the causes of death in this country.
Yeah,
And
I
then,
agree.
number 3 is accidental deaths. And there's Malcolm Johnson's good friend of mine is an emergency room doctor, and he wrote a great chapter on stupid things men do to get themselves put in the emergency room. Right? I mean, I'm sure you've seen, just like I have, every year one of your patients fell off a ladder putting up
Yeah.
Christmas lights.
Yeah.
Right? I mean, but you have to understand, right, that as the human body ages, it undergoes certain physiologic changes. Right? So it's
hmm
not like you're an idiot that you can't put the Christmas lights up anymore. But as you age, your balance isn't as good, your muscles aren't as strong, you're not as flexible, your vision isn't as good, your dexterity isn't as good, right? That's just what happens as you age. I saw it in an article the other day by the Fielding Lab out of Tufts. They compared a 20-year-old and a 50-year-old, and doing the same exercise, a 20-year-old's going to build 3 times more muscle than a 50-year-old.
Man,
Okay.
that's cold.
That's just the way it is.
That's
Okay.
great.
I don't care what 50-year-old you are. When you compare yourself to a 20-year-old, you're not going to perform at that level. So get the 20-year-old next door neighbor, flip him $20 and say, can you put my Christmas lights up?
Right. There you go.
Because an injury like falling off a ladder at that age is going to be catastrophic. The story that we tell in the book is the guy falls off the ladder, he breaks his hip, he's in rehab for 3 or 4 months, he gets addicted to opioid pain medication, he's in disability, he loses his job, he loses his wife, he loses his family, and we've all seen it. And it's just, it's not like Disneyland where the car stays on the rail. Life doesn't do that.
Mm-mm.
It just, a lot of times in life, you don't get second chances. You fall off a
Mm-mm.
ladder, you break your hip's broken. You can't
Right.
function
That's
like you
right.
used to. So
That's right.
just the awareness, like one of my favorite statistics in the book is 90% of eye injuries are preventable.
90.
90.
Yeah.
You put on safety goggles. So next time you go out to the backyard, and take out the Sawzall and start chopping trees or metal or whatever you're chopping up in the back. I mean, I'm a weekend warrior. I love doing work in the backyard, but I'm like, I just think back on that. I don't want to be one of those 90% that's just stupid and they got a little piece of sheet metal stuck
Yeah.
in their eye
That's right.
and now
That's
they're
right.
blind in one eye.
That's crazy.
Just put
Yeah.
safety glasses on or um, gloves. 50% of hand injuries are preventable by using gloves. Right. So, some of this stuff is really common sense, but it's not common sense that we think about.
But
And
we
so
need
if you read through the
reminders.
book and say, and, it's not a 20-page chapter saying wear gloves. It's like, a couple paragraphs. Don't be an idiot. Wear gloves when you're doing stuff. And 50% of the time, you'll save yourself from a really bad hand injury.
Yeah. We need reminders. And I think that's why a lot of times people come to the podcast and they're really expecting, they have, pen and notepad and they're really expecting some, aha, oh my God, I never heard of that. And those things exist, but man, the common sense. I noticed a young man who was kind of running down the stairs, right? And I'm at a point in my life where I'm 54. I don't run down the stairs anymore. I walk down the stairs, right? I'm so serious.
Take the
I'm not
elevator.
running. A. I will. Yeah, I'm taking my time because my brain understands. As a clinician, I know that a lot of these accidents happen doing something very simple, but there's no need to rush. So I think reminding people of these very basic concepts will remind them not to do the things that are silly. Yeah, if you're doing something with the saw and stuff is flying all over the place, just put the goggles on. I just think that those are basic principles. Now, you mentioned during your comments, you're not 20, you're not 30 anymore. So a lot of people come into this podcast, this episode, when they see your name, they'll see urologist, they want to get some tips on sexual health. So we want to honor that by, maybe sharing some of your thoughts about,
Yeah,
any thoughts on sexual health that would be helpful for my audience today.
absolutely. Okay. So sexual health is circulation. Okay. So anything that you can do to maximize circulation. And that's sort of how I got into the concept of writing the book. And the book didn't start out as 900 pages. The book started out as like 100 pages, 200 pages. And every time someone came into the office with a different problem, I would say, well, that would be a great chapter. Oh, that would be a great, someone came in with sleep apnea. He was in his late 30s and he had erectile dysfunction. And it was because he had sleep apnea. He wasn't getting into REM sleep. He wasn't getting good erections. I said, oh, we need to write a chapter on sleep. So, the first thing you can do really to improve your sexual health is to improve your circulation. And anything that's going to compromise your circulation, whether it's smoking or drinking too much or being sedentary or eating foods that are high in cholesterol, et cetera, are going to affect your erections. And so when you're in your 20s and 30s, you get nighttime erections. But at a certain point in life, you stop getting nighttime erections. Okay, that's the first aha moment. It means your circulation isn't as good as it used to be. Okay, 10 years after that, you're going to develop erectile dysfunction. And 10 years after you develop erectile dysfunction, you're going to develop heart disease. You're going to have a heart attack. You're going to have a stroke, right? So you really have a 20-year lead time in terms of knowing that things are changing. And if you're not going to take the morning erection thing seriously, at least take the regular erection thing seriously, because doing so is going to save your life. Okay, now I divide up the treatment for erectile dysfunction. I have a whole algorithm of how to do this, right? Into the signal and into the pipes. Okay, the signal that we have to open up blood vessels is something called nitric oxide. Nitric oxide is the second messenger. When I was at UCLA, um, my professor won the Nobel Prize for figuring out that nitric oxide is used to open up blood vessels. Nitric oxide is in foods. It's also produced on the inside of our blood vessels and by our nerves. And as we get older, we make less and less nitric oxide. So it's kind of like a dimmer switch turning down blood flow. So as we get older, we get high blood pressure and we don't have as good circulation. So one thing I do is I have a supplement called Affirm. Um, and our company is Affirm Science at firmscience.com. And it's a nitric oxide boosting supplement, right? And it's watermelon and beets and a couple other things, but primarily watermelon and beets, because watermelon creates citrulline. Citrulline turns into arginine, which is the nitric oxide donor, and beets have nitrates, which get turned into nitrites, which get turned into nitric oxide. And that opens up blood vessels all throughout the body. So it improves cognition, improves brain function because you get better brain circulation. It improves athletic function. So a lot of endurance athletes and bodybuilders use nitric oxide as their pre-workout. It's amazing for blood pressure. I had a patient the other day. He couldn't believe it. His Stanford cardiologist was flabbergasted. His blood pressure was running 145, 150 over 100. I put him on 2 tablets of Affirm morning, 2 tablets at night. He came in the other day. His blood pressure was running 118 over 75. And his Stanford cardiologist wanted to put him on a thiazide. He wanted to put him on a calcium channel blocker. And I said, do me a favor, just take the Affirm, see what happens. His heart rate went down, mean arterial pressure went down, blood pressure went down. So taking a nitric oxide booster, especially when you're in your 30s, early 40s, you're starting to lose those nighttime erections, are going to dramatically improve circulation. Okay. The second thing you can do to boost circulation is take a PDE5 inhibitor. So PDE5 inhibitors are like Viagra, Cialis. The beautiful thing is these things are generic now. So tadalafil, sildenafil, they're very inexpensive. I put a lot of my patients on tadalafil, 5 milligrams, put it on, take it every night. 5 milligrams every night rarely has any side effects and will help you get nighttime erections. Nighttime erections are like your penis going to the gym, right? Every night when you hit REM sleep, you should be getting good blood flow going into the penis and helping you get erections. Okay, but this is just boosting the signal. As soon as you take that signal away, the benefits go away. So the other part of it is how can we improve the arteries? And we already talked about diet and exercise and all that kind of stuff. I won't beat that sort of dead cow. But the other things that you can do, which is really why I got into regenerative urology, are things like low intensity shockwave therapy or Gainswave. Okay. And what we do is we use pulsed acoustic waves to stimulate the growth of new blood vessels. So what it does is it tricks your body into thinking that there's an injury. And when your body thinks that there's an injury, you generate an injury response. And part of that injury response is growing new blood vessels. So you have what's called collateral circulation, or circulation around the blockages. The other thing that I do is use platelet-rich plasma, okay, which are basically platelets that we extract from your blood. And platelets are like little miraculous cells, right? They have two functions. Everyone knows function number one, which is stopping bleeding, right? So if you cut yourself, you get a clot, you get a scab, but then the scab peels off and the skin grows back. Well, why does the skin grow back? Have you ever paused and said, why does the skin grow only in this spot and not in the rest of my body? And the reason for that is the platelets are filled with growth factors. So it's really a miraculous little cell that hones to an area of injury, causes a clot, releases growth factor, which then begins the process of rebuilding. And so people use PRP in orthopedics. So a lot of professional basketball players and football players and so on and so forth do that. It's used in hair growth, but in urology, it's used as what's called a P shot, which is in the penis, or an O shot, which is in the clitoris in women. And these things all in combination help to regenerate a guy's ability to get erections. See, I lost the volume again.
Yeah, I got to stop muting myself. I'm in a clinic, so I want to make sure the
Yeah,
announcements don't
no
piss
worries.
off. But I'm gonna tell you some. That's a good answer because um, I wanted to make sure my listeners walked away from this conversation with something, tangible. Those are really good talking points. I guess I should probably still, go to that other male, gland, which is the prostate. And if you could just comment a little bit about, things that men can do to have a healthy prostate. I know there's some overlap potentially, but any thoughts on the prostate?
Yeah, no, I wrote a really great chapter on the prostate. So really, there are a couple things that can happen to the prostate. It can get infected, which is a really bad thing. It can grow really, really large and make it difficult for you to urinate, which is, a bad thing, but not a catastrophic thing. And then it can become cancerous, and that can be a bad thing. It can be a not so bad thing. And so um, maybe I'll hop onto prostate cancer quickly. So, there was something called the PSA, which is a prostate cancer screening test that enabled us to diagnose men with prostate cancer at a much early age, 5 or 10 years before we
Hmm.
previously would have diagnosed prostate cancer. But in our sort of zeal to help cure the world of prostate cancer, we affected a lot of people's sex lives
Hmm.
and their continence. And um, and so prostate PSA as a screening test was highly, highly criticized, and for good reason. Um, but now we have technology. Technology has helped us catch up and figure out who should get treated and who
Hmm.
shouldn't get treated. So some of the technologies we have now are MRIs. So previous to about 5 or 6 years ago, MRIs were useless for diagnosing prostate cancer, but now MRIs are super valuable in terms of determining where prostate cancer is, how prostate cancer is distributed throughout the prostate, how whether it's escaped outside the capsule of the prostate, how much prostate cancer is there, or whether you just have a big prostate with no prostate cancer. And so one really important takeaway is do not let any urologist biopsy your prostate unless you have gotten an MRI of the prostate. And if a urologist is going to biopsy your prostate, make sure it's an MRI guided fusion
Hmm.
prostate biopsy. Okay. So there's a non fusion prostate biopsy that people say, well, it's MRI guided because I know where it is on the
Hmm.
MRI and I'm just going to do a regular old biopsy and just try to aim that area. Uh-uh.
Hmm.
Those are not as accurate as what's called a fusion biopsy. And the problem is the government doesn't pay you anymore for doing a fusion biopsy. It takes extra training, it takes 3 times as long, and it takes about $250,000 worth of equipment.
Okay.
Right. So I was one of the first private practices in the country to get an MRI guided fusion biopsy because I thought it was such an important uh, uh, development in the diagnosis and treatment of prostate cancer. And my biopsy positivity rate went from 35%, which was pretty standard for that time, to 85%. Right.
That's huge.
Imagine, like someone's a 35% free throw shooter, and then overnight they become an 85% free throw shooter.
Mm,
Right. Well,
huge
you would
difference.
probably want to use that technology. Right. And the reason was I wasn't unnecessarily biopsying patients who didn't have prostate cancer. And the ones that did have prostate cancer, I would hit the target almost every single time. Okay. So, definite takeaways. One, don't be afraid to get a PSA. Two, if your PSA is elevated, don't get a biopsy unless you're going to get an MRI first. And don't get an MRI, don't get a biopsy unless it's an MRI guided fusion, where we take the MRI image and the ultrasound image and fuse them to increase
Hmm.
the accuracy. And
That's
the other
perfect.
thing is there is genetic testing
Hmm.
of the prostate cancer. So, there's an appearance of prostate cancer cells that give us what we call the Gleason score. And it's always important, it's I got guys that are PhDs, right? And I say, well, what's your Gleason score? Where's your op report? Oh, I don't know.
Hmm.
Okay, but then you get a blender from Amazon. You open up the box, you take the instructions for the blender, and you put them in a little file that says blenders. Right,
Right.
file that away just in case you can't figure out what was going on with the blender. You have the instruction book to look at how to you fix your blender. But the most important aspects of your health. What's the grade of my prostate cancer? Nah, I don't know. The doctor told me it was bad,
Okay.
so make sure that you keep all the records that are important so that when you see another doctor, you have all that information for them. And so genetic testing we can do on the prostate cancer so that if sometimes a Gleason 6, which is a low grade prostate cancer, is going to behave more like a Gleason 8 or 9. And we don't know that from the appearance, but we know that from the genetics. And so we can save a lot of heartache.
Finger question, prostate exam, real quick. Should we bother with that if in an
Yeah,
asymptomatic?
it's a good question. No one likes to do it, and
Yeah.
no one likes to get them done.
Hmm.
Um, I've saved dozens of guys' lives by doing a prostate exam when no one else wanted to do it. Even urologists, that would say, "Oh, maybe we'll do it next year." So it's when you're taught to do a physical exam in medical school, you're taught to do, check all the cranial nerves and listen to 6 or 8 different parts of your lungs. And, uh, you know, in medicine, if you cut corners, you're always going to get burned. You may not
Hmm.
get burned today or tomorrow or next week or next month, but if you're there at the doctor and the doctor's willing to stick his finger up your butt and feel your prostate, just let him do it or let her do it. I mean, it's doesn't mean that you've switched teams, or you're any less of a man. It just means that you're taking control of your health because that it's there's nothing worse than seeing a guy with advanced prostate cancer that says, gosh, I wish I would have let that doctor do a prostate
Hmm.
exam, or I wish I would have gotten a PSA 5, 6 years ago. I mean, it's kind of pathetic.
Hmm. Yeah,
You know,
absolutely.
it's like,
And I
oh,
think
you're
that's
macho. But how macho is it when you got to put someone on Lupron and medically castrate them?
right. Yeah, that's that's
You
that's a
know,
that's an understatement. So it
yeah. I
sounds like
mean, come on, man.
Right, right. Yeah, yeah. It's you got to decide what your poison is, right? So it sounds like so what I'm hearing is that a PSA is definitely a great way to predict things way in advance, but it may not be a bad idea to do both. Is that what I'm hearing?
Yeah, I
Instead
mean,
of just
the
doing
thing
one or
is,
the
if you
other.
go to the doctor and your doctor's willing to do a prostate exam, there's no downside of doing a prostate exam.
That's right.
There's no downside of getting a PSA as long as you take control of the situation and don't overreact. Get proper information, and that it's all in the chapter in the book. You know, I will be the first to admit that 20 years ago we overtreated men with prostate cancer, but now
Yeah,
we have the technology to understand much better who needs to be treated and who doesn't need to be treated.
perfect. Okay. So in terms of, we'll kind of wrap up with the last two questions. Just your vision of what you'd like to see change in our health system, improve. I mean, where do you see that going in a direction that would resonate with you?
Yeah. Oh gosh, that's a big question. So there's a chapter in the book on health insurance.
Hmm.
I think it's the best chapter ever written to help people understand health insurance. We have the most messed up health system in the world.
Hmm.
That's my personal opinion, but that's the opinion of a lot of really smart people that I've heard speak and worked with. It's fantastic for a small subset of people, and it fails a huge number of people. And
Hmm.
um, and it's really important that you understand the basics of healthcare economics. I have PhDs from Lawrence Livermore Lab, guys that are shooting missiles out of the sky for our defense. And I say, do you have an HMO or a PPO? And they'll look at me like, what's the difference? It's like the most basic
Right,
fact about health
right.
insurance, and you're a nuclear physicist, but you don't understand that, right? And so this chapter really, I wrote it with two MPH students from UC Berkeley and a healthcare executive, and it really breaks down what's an HMO, what's a PPO, what's an EPO, what's a copay, what's Medicare, what's Medicaid, what's Medi-Cal, what's vision plan, what dental plan. You got to understand this stuff because you're paying as a family 25,000 bucks a year
Yeah,
for health insurance now,
that's right.
right? So you better know a little bit about the investment that you're making. And so the 21st Century Man has an amazing chapter on understanding health insurance, also how to choose a doctor, how to kind of
Cool.
research your doctor.
Yeah, I think that's critical. People need just basic advice, like again, just a guidebook, and I think that's why your book resonates with me. So when I think about you protecting your nest over the next 12 months, what parts of what are you planning to focus on? I know we're focused on a lot of things. We talked about relationships and things like that, but where are you going to put your attention so you can still be here to deliver these great messages?
Wow. Well, I'm kind of all over the place. So, but the at the end of the day, the most important thing to me in my life is my wife, my kids, my family, educating them, providing for them,
Yeah,
and for me, just living uh, the best life that I can, being the hero of my own journey, not doing the things that I know will be destructive to me and my family, and trying to teach, my kids the values and the healthy habits that I try to keep. Knowing that end of the day, I'm not perfect. I got plenty of my own problems, but just trying to be proactive about taking them on.
yeah, I like that. I appreciate that. And let's make sure we can ensure that everybody checking this out can, know how to find you, know how to find your resources. So what's the best way to make that happen?
Sure. So I have a medical practice website called Brandeis MD, BRANDEISMD.com. And I'm in Northern California, but I got patients flying in from all over the country. And I do, these really kind of fun, crazy clinical research studies. So I have one. We figured out how to get guys better orgasms using electromagnetic waves. I have a technology to improve muscle 10 to 15 times faster than you can do in the gym. We're doing studies on that. I have a study on improving the size, the length, girth, and function of a guy's penis. And we'll be presenting that hopefully in October. That'll be really a fun study to unveil.
Interesting.
And on my book, The 21st Century Man, all written out in letters. So the 21stcenturyman.com. We have an audio book, we have an ebook, we have a hardcover book. There's that whole segment I did on how to make the most of your doctor's visit that you can just watch on that website. There's information on the other 50 or 60 authors of the book and their expertise. And then my supplement, I have a men's health supplement line at affirmscience.com. So Affirm is our nitric oxide booster for erectile function and circulation. We have one for premature ejaculation called Prelong. We have one for prostate health called Spunk, and one for testosterone boosting called Support. And what else?
I love those names, man. Those are some fun
Yeah,
names.
it's my twisted mind comes up with those things.
Well, they're appropriate, although very entertaining. So I appreciate that. We'll make sure uh, to share links to all that great information in the show notes. I think that's wonderful. And I could tell from your personality that it's probably going to be fun to read your book as well. So I'm looking forward to diving a little deeper into it. So I really appreciate you, man. Just taking some time to share a very important topic, a topic about men's health, and we want to make sure the men are not forgotten. Happy belated Father's Day to you as well,
Oh
by the way.
yeah, you too.
Oh,
Absolutely.
absolutely. Love it. So thank you so much. And as we kind of wrap up this episode with our great doctor, our urologist, who has given us some great insights, I really want to say I appreciate all those who checked out this episode and joined us today. And as you've noticed, being healthy is not just about maybe one aspect. It's not about just going to the gym. It's about understanding where you may struggle, and it may be a struggle in your relationship. And if you're struggling, you need to give that some attention. You may need a relationship coach to help you and your partner to get through that struggle. And so rather you're working on how you think, your emotions, your relationship, even being grateful. Today's guests really help us understand that it's a little deeper than just, again, going to the gym. It's a little bit deeper. And that's why it resonates with me, because my whole Protecting the Nest podcast is about looking at those other things that can impact us. So as we continue our journey towards optimal health, just know that you're not alone. You have myself, you have our Dr. Brandeis here to walk with you. That's right. You even have organizations like the Society of Metabolic Health Practitioners to support you as you become metabolically healthy. So I extend our hand of support to you. Just grab that hand and walk with us collaboratively as we help you heal, help you achieve metabolic health, and just help you achieve your ideal state. So for those who are watching or listening, I appreciate you. I thank you. And as I conclude, I want to just ask that you continue to be safe, be well, and continue to protect your nest. And thanks again, Doctor, for being with me today.
Oh, my
Appreciate
pleasure.
it.
Thanks a
Absolutely.
lot.
No problem.